Hundreds of senior doctors are meeting in Brisbane tonight with talk of mass resignations from the public hospital system. They're angry over new individual contracts they say are being imposed on them by the state government. Leonie Mello reports.
It's rare to see senior doctors rallying over industrial issues.
SMOs say no! SMOs say no!
But about 100 of them gathered at Ipswich, protesting against individual contracts.
Harsh, unreasonable, draconian contracts. They are worse than work choices.
Doctors will be at least as well off as where they are now, or even better off.
Another mass meeting is on tonight. Regional doctors are flying in. Others will hook up via Skype. Doctors argue the government will be able to alter their hours of work and pay, move them around the state, and unfair dismissal will no longer apply.
We are not reopening formal negotiations. The issues which have been raised have been dealt with adequately. It's about time there's some honesty in this debate.
People doing what I guess called emu politics, which is head in the sand and bum in the air. And that's really quite annoying when people tell us we're flim-flammers.
There's now talk of mass resignations.
I think that 1,000 to 1,500 out of their 3,000 workforce are considering resigning. There's a lot of email traffic to suggest that the members want to do a mass resignation.
A doctor that works 40 hours a week at the moment will continue to receive on average $350,000 a year. So there is no real issue.
The doctors disagree.
And reporter Leonie Mello joins us now from the doctors' meeting at Woolloongabba. Leonie, what's the mood like there tonight?
Very fiery, Karina. The meeting is just getting underway. There are some 400 people already here from all over the state, and they are still queuing up down the stairs out onto the street. Now, this is normally a group of people who are very conservative, but they are particularly upset about the way the state government is handling, or as they see it, not handling these negotiations for the contracts. The state government says, well, they've got it wrong, and once these contracts start going out, half by the end of this week, the remainder by the end of next week, the doctors will see the extraordinary protections that are in place.
There's talk of mass resignations. Just how likely is that, Leonie?
Well, that remains to be seen. We're told that resignations are going to be discussed tonight, and certainly talking to many of the doctors walking in, they were adamant that that was the only course of action. Others say that that is overstating it and they would much rather sit down and talk about this. But there will be formal resolutions made on an action plan going forward. The doctors are very clear that this is not about the money, it's about patient care and the quality of the health system. Now, the federal arm of the doctors' union, the SMOs union, they are also here. They say they'll support whatever is decided by the doctors at this meeting, but they also have a plan ready to go that can be up and running in 2 to 3 weeks. They're calling it an emergency services plan, that should these doctors decide to resign, there is a plan to get underway that will ensure the patients in those affected departments will still be cared for. Karina?
Leonie Mello, thanks very much.